Kathleen Dahm. I'm the medical director for foster care at Select Health of South Carolina. And actually, Gwen Goodlett is going to give a brief introduction just to give some background information before we get started today. So Gwen, I'm passing it over to you for now.
Great. I hope you all are doing well. So glad to be here today. Thank you all for joining us. So one of the great things about this TeleEcho clinic is that we have a chance to get feedback from you all, and we get to respond to that feedback. And one of the questions we got from our last week's session, or 2 weeks ago session, sorry, our last session, was that there was mention of a lawsuit, and people wanted to know just a little bit more about that. And so I wanted to talk to you all about that just a little bit from South Carolina Department of Social Services perspective. We're all familiar with it. We live with it every day. It's been a great tool for reforming our system. But we wanted to make sure that you had some context for it too. In 2016, Governor Haley consented to what's called a consent decree in a federal lawsuit alleging that children in foster care were not getting what they needed. And that ranged all the way from physical needs all the way to medical needs and what have you. And as a result of that lawsuit called Michelle H., if you've heard it called that, that's what it is, the state has been undergoing a significant reform in the area, in all areas of SC Department of Social Services. And one of those areas that's been most pronounced is healthcare. And so the office that I now head up, the Department of, or the Office of Child Health and Wellbeing at SCDSS, was created as a result of that reforms of that lawsuit. And the nurses that we have on staff that you're going to hear about today were also created in response to that lawsuit. So the lawsuit is very sweeping in its reform agenda, and it's very broad. And although I think many people would love for us to have made reforms without a lawsuit, I think it's brought about many, many positive changes. So I just wanted you all to be aware of that and be aware that we think of it, although it's sometimes not easy having people, over your shoulders and telling you to do things and whatnot. I do think they are pushing us to make a very positive reforms for our child welfare system. And I know as a result of the work that Karen McDaniel and her team are doing and the team at Select Health, I know that we have seen many, many, many things improve for children in foster care. And this is part of that effort. And I mentioned that our office and the nurses are part of that reform, but also the entire team you're going to hear about at Select Health is also as a result of that lawsuit. So this is all good stuff. It's all happening, and it's change that's going to bring about, I think, much better services and much better coordination for children in foster care. So if you have any other questions, y'all post them in the chat box, and we'll be happy to answer those at the appropriate time. So that's it, Dr. Dahm, back to you.
Okay, thank you. Shoshana, can you please share the PowerPoint? Okay, thank you. So I'm Kathleen Dahm, and Dr. Wallace is also going to be presenting. We're kind of dual, doing this together today. So the topic today is resources to support your practice at South Carolina Department of Social Services and Select Health of South Carolina. And then we're also going to talk about billing and coding and just an introduction to the 21st Century Cures Act. Okay, great. So we can go to the next slide, please. Okay, so Dr. Wallace and I do not have anything to disclose today.
Frankly, it does, as Speaker Pelosi said.
Okay, so the learning objectives today are to understand the existing resources at South Carolina DSS and Select Health and how to access those supports when needed. We also want you to understand when and how to bill the 99358 code for a foster child's initial visit with a provider, and then understand the basics of the 21st Century Cures Act. Okay, so we'll go to our first polling question, Shoshana. So if you are caring for a foster child in your clinic and need to contact a representative at DSS regarding the care of that child, do you know how to find the DSS employee's contact information? So you can fill in yes or no on the poll.
Okay, I'm going to end the polling. Then I will share the results.
Thank you. Okay, well, actually, that's great. So 77% of the people who answered said they do know how to find that person's contact information. So I think that's great. 23% said no. Okay, go to the next slide. Okay, so we'll start by talking about the South Carolina DSS Wellbeing Team. The Wellbeing Team can help you in a multitude of ways and help your patients. So they can facilitate the behavioral healthcare and dental needs for children and youth and families that we serve. They provide assistance and support to addressing children and youth who have significant therapeutic needs. They'll help provide support and guidance in addressing educational needs, which we all know is so important, especially with the pandemic, and provide support and guidance to children and youth involved with multiple state agencies. Okay, so we can go to the next slide, Shoshana. So if we think of the Wellbeing Team office, there's the Wellbeing Team manager at South Carolina DSS. And these regional managers can be considered a sort of air traffic controller. So if you're trying to access supports at DSS within a given area of the state, you want to contact the regional well-being manager if you don't know who else to contact. And they can help you find supports and resources in areas such as education, juvenile justice, autism and intellectual disabilities, and mental health. Now, South Carolina also has nurses on staff at DSS, and we'll talk about them a little bit more on one of the next slides. And we also have the staff child psychiatrist, Dr. Anita Ketpal. And she's actually a great resource for the clinical staff at DSS, provides support for them, provides clinical trainings and consultations. She also participates in our joint foster care rounds with Select Health and DSS. And then she evaluates children who have sort of red flags for multiple psychotropic meds. So she helps kind of look out behind the scenes for all those children. Go to the next slide. Okay, so this is the contact information for the various well-being team managers. And we'll make sure these slides that have specific contact information for various individuals get passed on to you in the information we send out to you after this presentation. You can go to the next one, Shoshana. Okay, so also the nursing team at South Carolina DSS is a wonderful resource. Karen McDaniel and her team serve as patient advocates, and they're resources for providers to understand the child welfare system and help you access all the care that you'll need for your children who are in the foster system. So they'll help make sure that children are getting well visits according to the enhanced well visit schedule that we talked about at the last Project ECHO, their follow-up needs, and then their dental needs as well. So this is the contact info for the various DSS nurses in different regions. And again, we'll make sure you get that contact info as well. There's also a statewide nurse and dentist who is on staff at South Carolina DSS, and she can help navigate access to more complex dental services for children and youth. Also, she can help navigate access to orthodontics if needed, but that's, of course, only if medically necessary for functional or nutritional needs, not for cosmetic needs. And she also serves as a group home liaison. Go to the next slide, Shoshana. Actually, I think we have, do you have the polling question, Shoshana?
Okay, I launched
So
the poll.
would you be interested in joining a community of South Carolina foster care providers through a listserv if we were to create something like this to help in case you had questions about caring for children in the foster system?
Okay, I'm going to close the poll. I'm going to share the results. Are you able to see it, Dr. Dunn?
I cannot actually. Something just happened to my Zoom connection, so I actually can't see anything on the screen right now. So if you want to, read the results of the poll?
Yeah, absolutely. So 89% of the participants today are interested in being part of a listserv.
Okay, that's great. So that's something that Gwen Goodland and I will be looking into creating.
So Dr. Don, would it be helpful to you if we told you what slides were up there? You're now at the collaborative foster care round slide. Have we lost you, Dr. Dom? Are you on mute?
I think we might have lost her, Gwen. It's Liz.
Do you want to take it
Yep.
away?
I can jump in.
Or I can help too if you need it. Just holler.
That's fine. I'm happy to. So for anyone who doesn't know me, I'm Liz Wallace. I direct the foster care clinic at MUSC. I'm on the PEDS faculty here. So the collaborative foster care rounds occur every Thursday at 1 o'clock. And the idea is that DSS and Select Health and any other providers that may be involved are able to look at patients who are struggling, whether it's because they're going to the ER every other week and they don't have a PCP, or they've had multiple psychiatric residential treatment facility admissions, so are living in like long-term care facilities, basically. Kids who have significant needs, like intellectual disabilities or like multiple chronic conditions or medically complex kids, or kids who may have kind of emergent needs that need to be met, like they need an acute admission somewhere, or other kind of dental emergencies, that type of thing. And as I understand it, I've participated in the past, not like on a regular basis, but when I have a patient involved, and have been invited to present in the past. It's really helpful to just get everybody at the table and kind of think about what does this kid need and how do we make it happen and how do we have kind of concrete next steps. Next slide, please. And Kathleen, if you get back on, just jump in anytime. Because she's obviously going to know the Select Health resources better than me, but I know them decently well, having worked with Select Health quite a lot.
Okay.
Are you
Liz,
back, Kathleen?
I can hear you now. I just can't see any of the slides yet. So why don't we just go through the slides and I can kind of briefly discuss the structure at Select Health, and then you can go on to the next part of
That works
the
perfectly.
presentation. So, and Shoshana can just sort of advance the slides, you know, as we go along. So the team at Select Health, we have this care coordination team. So we have 17 associates on the team, 2 managers, and a supervisor for the team. So basically, when a child enters the foster system, they will be enrolled, unless they have a a waiver to have another type of Medicaid, like the medically complex children's waiver. They'll be enrolled in Select Health, and they'll also be enrolled with Select Health Care Coordination for the first 30 days that they're in the foster system. And then we'll reevaluate. For some children, they'll stay on longer if they have complex needs. So some children will be involved in more complex care coordination for 6 to 9 months. So for example, currently we have about 738 children enrolled in the foster care team with Select Health. So in other words, everybody will get that care coordination for the first 30 days if they're in the foster system, and then they may get it for longer depending on their needs. So the Select Health Care Coordination team will do a lot of behind the scenes work for your patients. So they will support, making appointments for well visits, making appointments with specialists, ensuring that follow-up care is being met and that there are no significant gaps in care for these children. They can also assist with medication refills. They can help educate about the prior authorization process. They can help with logistics for getting to and from appointments, like the Logisticare bus for Medicaid. And many other needs can be met using this Select Health Care Coordination team. So I know Shannon's on the call. Shannon, is there anything else that I haven't spoken about regarding Select Health Care Coordination that you want to add?
No, that's great. You covered everything very well. So, if they have any questions, they can always reach out to us.
Okay, great. So, basically Select Health Care Coordination will be helping your patients behind the scenes. So that's what we wanted to let you know was available. Shoshana, do you want to go to the next polling question?
All right, I have launched the poll. Gonna leave it up for about 3 more seconds. Okay, I'm going to close the poll. And the results are 28% do know how to, I'm sharing it now, 28% do know when and how to bill the 99358 code, and 72% say they do not know when and how to appropriately bill the code.
Sorry, I started to talk on mute. I apologize. So I'm going to talk a little bit about billing and coding for youth in foster care, and probably the most important takeaway from this is how to use the 99358 code. So this is a relatively new addition to the Medicaid billing options, but it allows us, when it's a new patient, to bill for when we're doing a well visit for a youth in foster care, allows us to bill for non-face-to-face clinical care, whether it's reviewing records, doing care coordination, reaching out to the DSS case manager, any of that work that takes up to an hour, we can bill 99358. It does require a UA modifier, which is specific to foster care, but it can be, and it's the question, sometimes people will ask me, like, is it better if I bill now that I can include all of that stuff in the E&M codes as well as of January 1st? We've been using this code for the last 6 months in the foster care clinic. I did check this morning. We are actually being reimbursed for it. It's worth 2.1 RVUs. I'm judged based on RVUs, not on collections or charges. And so it's really helpful for me to know the RVU value as well. But we use this code really for any of the work that we as the clinician do before or after related to direct patient care. Another option, right, would be with the E&M code changes, would be to bill based on time. So if you're doing not so much a well visit, but if you're seeing a kid for a follow-up visit for like a 99213 4 or 5, think about using time-based billing, because a lot of times these kids take a lot of work to track down services and track down records and things like that. And as of January 1st, the new CMS guidelines, that doesn't have to be direct face-to-face time. It does have to be work that you as the clinician are doing. And it does have to be the same day, but it does not need to be necessarily face-to-face care, which is a change. So that's another option. So the 99358 you're going to use with the well visit for the first time you're seeing the patient, and then subsequently think about using time-based billing. Next slide. The other thing, and I will say we have done this some, we probably are not utilizing this as much as we should, but as of July 2019, you can now bill as a well and a sick visit on the same day using a modifier 25. So you use the well child, and I'm assuming most of you who are out in private practice probably know this already and have been doing it. But you use the well child diagnosis code as the first diagnosis, and then the second diagnosis is your acute problem or your chronic problem, whatever you're addressing. And you bill that as a sick visit with a modifier 25 on the same day of service. You do have to completely do the well visit, but for those of us that are doing a well child visit and an ADHD follow-up, for example, it's a really useful way to make sure you're getting credit for the work that you're doing. Next slide. And lastly, I'm going to talk briefly about the 21st Century Cures Act as it relates to youth in foster care. Though it has not completely gone into effect yet, some of the parts have already gone into effect. The thing that we have seen the most is the issue of open notes. So it requires that healthcare providers give patients access to all their health information in their electronic medical record. Next slide. So things like for inpatient, we have our inpatient notes are now available to patients at the time of service. Outpatient notes are available with the exception of things like psychotherapy notes, and there are a couple of other exceptions. Progress notes, lab values, imaging, things like that. The thing that we need to remember for youth in foster care is that this is a great way for patients to have more access to their own health care. But we also have to think about who can access this information. So while foster parents can be designees and consent for routine health care, really this is information that DSS workers or the bio families should be accessing. So for example, we do not give MyChart access or kind of patient portal access to foster parents because they're not able to have this specific information. And with the 21st Century Cures Act, a lot more information is available, which is good. But we also need to think about the privacy of these kids and how they access the information appropriately. Next slide. So psychotherapy notes are excluded, as well as anything that could be potentially damaging to the patient. You don't have to release. But basically, anyone who's a mental health professional who's documenting like the contents of a private counseling session or a group session or a family session can be considered a psychotherapy note. And so those do not need to be shared with the patient at the time of service. Next slide. There are a number of exceptions to the disclosing records. So one is preventing harm. So again, if it would cause the patient harm or risk their privacy or security, there are exceptions to the 21st Century Cures Act. But I imagine that all of you have had to deal with this for your non-youth in foster care that you're caring for in your practice and how you release this information appropriately. And so the point that I would make is just remembering that for youth in foster care, it's very easy for their information either to be available to no one or available to everyone. So either you have no records on a kid or suddenly everyone has access to that kid's records, and we need to be mindful of both of those things and how we give out information. Next slide. Do you want to talk about these, Kathleen?
Hi, Liz. I can hear, but I still can't see anything at the moment.
Oh, gotcha. So it's the slide is about helpful websites and references. So it talks about Navinet and the South Carolina Health Information Exchange. So I didn't know if you wanted to talk about Navinet because it's a Select Health entity.
And just if you need any information from Navinet, Julia Powell, who I believe is on the call too, she does provider trainings on Navinet, or you can contact one of the Select Health or DSS nurses to help you.
It's just another way to get information about a patient as it relates to the information that Select Health has. The other thing is the DSS website has some information for healthcare providers. We also have a good amount of information on the Foster Care Support Clinic website. Next slide. Okay, don't forget to claim credit. Hopefully someone's going to explain to you how to do that. And then I think we're opening it up to questions from the group about the content of the presentation before we go into the case.
Yes, so Shoshana, you're going to stop the recording so that folks can ask